Hello, I'm Melissa Fuller with Shape of the City. Today we're going to learn about the Child Advocacy Center. I am with Maja Cartwright. She is the program director here at the Child Advocacy Center. Hi, Maja.
Hi, how are you?
Good. So tell us a little bit about the Child Advocacy Center for our viewers, especially who may not know anything about you guys. What is the key mission of the Advocacy Center?
So our mission is where small voices can be heard. We assist children of who have experienced some abuse, in a lot of cases sexual abuse, in some cases physical abuse or other things that they've witnessed, and providing the best services that are out there for them. There's a lot of things that happen, adult things that happen to little kids, and they have to navigate the system, and we are there to help them and assist them in that process, and a lot of times their family members also.
Give us an idea when we say child or youth, what ages do you generally handle, or who are the people that are coming through here?
For the most part, since we do a lot of forensic interviews, our ages are 13 to 18. We do assist children who are younger than 3 and who are sometimes older than 18 and might have some special considerations or delays that we can help them with.
Talk about how you partner in the community. Who are the people that you generally work with here in Lincoln?
So our referrals come typically from the police department or child and family services workers or the prosecutor themselves. There has to be an allegation of abuse that has been reported to one of those agencies, and then they give us a call and set up our services for the family. We do assist a lot of parents and caregivers without that report being made, but most of our services are through those agencies.
So for a viewer who may be concerned about a child's safety, that something may be going on either within their family or even maybe a friend's family or colleagues, what should they do?
The first step would be to give us a call and talk to one of our advocates here who have a lot of experience in the system and what to do. And then they will talk through the case and figure out what needs to be done. If there's a report that needs to be made, if there's a conversation that needs to happen with the child, if the child needs to come to us and have a forensic interview or a medical exam, the advocate will kind of navigate them through that and help them out. If there is a report that needs to be made, the advocate will help them make the report and tell them what to do and how to make that report, and stay in contact with them to figure out what else needs to happen.
What happens after that initial early reporting? What other services might you guys be able to help them out with?
Our advocates help the family find counseling and therapy resources for them. For most of our families who live here in Lincoln, they like to come back to the center and they like to have therapy here. And we partner with Lutheran Family Services and Project SAVE, who offer individual and family and group therapy to the families that we serve. And so it's kind of nice for those kids and even those parents to come back here, come back to the same place, and begin that healing process afterwards and just have it all in one building.
Why is some place like the Child Advocacy Center so important to our community? Why is it so crucial to help these kids at, early on and help them heal?
Our system was made for adults primarily, and so when we are dealing with children who are victims, we want to help them in any way possible. A lot of times they're going through a lot of difficult stuff, and it's hard to talk about the abuse. Most kids don't want to tell about what has happened to them because a lot of times they've been threatened, or it's somebody close within the family who has abused them in some way. And so it's already very difficult, and so with the Advocacy Center, we're able to make it a little bit more comfortable for them, make it a little bit more neutral for them to be able to open up and talk to our interviewers about what has happened to them. Sometimes they're not ready to talk about it right away, so we can help set up counseling or therapy if needed and have them come back when they are ready to talk about it. Other times they might need a little bit more time, and just coming here a few different times is just what they needed. It's also a very difficult system for parents to navigate, the investigations, and if there's a court proceeding and things like that, our advocates can help the parents figure out what they need to do throughout the system and how to help their children also and what to do for their kids.
Why do you think that is just so important to the bigger picture of our community?
We Obviously, we work with a lot of children and they grow up to be adults, and we want them to be healthy adults, and we want them, when they have their own children, to have healthy relationships and keep their children safe. And so everything that we do here has that piece afterwards too, and hopefully can help them not become victims again or have children who are safe also.
What can other viewers do just to help make a difference in the community or to help you guys?
There's a lot of different opportunities. We are a nonprofit, and so we take volunteers anytime, and there's a lot of different projects and things like that that can be done here at the center, as well as helping in any special events. We also have a lot of trainings that we offer to, whether it's parents or caregivers or just community members, about what to look for, what to do if you are presented with something, if a child tells you something or you notice something, what to do in that situation, how to make the report in that situation, also how to keep your organization safe from any abusers coming in there. And so you can go on our website, and a lot of our trainings are listed on there.
What general message would you give a viewer also in just to how to handle this sort of message? How should we be able to better help kids who are going through something like this?
Most kids just need at least that one support person, somebody who believes them and tells them that it's okay and everything's going to be all right, and that they did the right thing by telling somebody. That's what they need. That's what's most important to them. It doesn't matter what happens to the case later on. They just need somebody to be in their corner for them. And so being that person for a child is very, very important for them.
Perfect. Thank you so much, and it's amazing the work you guys are doing.
Thank you.
Hello, my name is Ayman Smer. I'm a cardiologist at Child Health. Do you know what's really killing you? We all watch the news. Never before seen a virus, an emerging safety alert, or incurable disease? You may be searching symptoms or signs right now, but the number one world killer is not something new or sensational. It's plain and simple: heart disease. Close to half of all Americans have at least one major risk factor linked to heart disease: high blood pressure, high cholesterol, and smoking. Other conditions that increase the risk of heart disease: diabetes, overweight and obesity, physical inactivity, and excessive alcohol use. Lower your risk factor, lower your risk. Fighting heart disease is that simple.
This update brought to you by CHI Health.
Hello, my name is Lauren Rathman, and I'm a dietetic intern with the University of Nebraska-Lincoln. According to the CDC, heart disease is the leading cause of death in America. In fact, 1 in 4 deaths are from heart disease. Being diagnosed with heart disease can be overwhelming, but today I'm here to set the record straight that you can eat for the health of your heart. When it comes to choosing heart-healthy snacks, there are 2 important nutrients to consider: sodium and saturated fat. We can all be more mindful about how much sodium we add to our foods at the dinner table. But what other foods are high in sodium? Normally, foods like prepackaged foods and pre-prepared foods are high in sodium because it's used as a preservative. These snacks include cookies, crackers, chips, nuts and popcorn, breads, deli meats, canned vegetables, and fast food. Now, a lot of the foods I just mentioned are healthy for us, and we can and should enjoy them. The thing to do is to look for the words reduced, low, or no sodium on the package label. So now that we've talked about sodium, let's talk about saturated fat. Saturated fat is normally solid at room temperature and is worse for our heart health. Examples of foods high in saturated fat are animal products and dairy products, such as the fattened meats and butter and lard. Unsaturated fats, on the other hand, are liquid at room temperature and are generally better for your heart health. Examples include vegetable, canola, and olive oil, and fats from avocados, nuts, and fatty fish. Some heart-healthy snack options include fresh fruits and vegetables, edamame, yogurt, parfaits, smoothies, just to name a few. For a quick and easy heart-healthy recipe, try this fruit smoothie. Thank you for joining me today while I set the record straight on how you can eat for the health of your heart.
So they say it's a man's world? I don't see anybody's name on it.
While they were doing their thing, we slowly changed all that.
Today, women can do anything men can do. And there's one thing we're even better at.
Hi, I'm Adnan Khalid. At CHI Health, we know exercise does the body good. But did you know a little physical activity can help the people with heart failure stay out of the hospital and live longer? A new study showed the risk of death is reduced by 18%. That does not mean you have to start training for a marathon, but it does mean that a walk around the block won't hurt you. Of course, check with your doctor first before starting any new exercise program.
This update brought to you by CHI Health.
What if you could add 5 years to your child's life and make your whole family healthier with simple changes? Partnership for a Healthy Lincoln wants you and your family to live longer, healthier lives. It's easier than you think. Walk the dog every day, play more, and text a little less. Swap out a sugary soda or energy drink for water once a day. Keep fruits and veggies handy for snacking. These simple changes can add 5 years to your child's life and make your whole family healthier. Learn more at healthylincoln.org.
February is Children's Dental Health Month, and I am here with Stacy Woida. Hi, Stacy.
Hello.
Stacy is with Lincoln Lancaster County Health Department, and she is going to be going around Lincoln, mainly at the libraries, correct? And helping inform parents and kiddos on dental health, the importance of it, and how to go about doing that. So, Stacy, let's start initially with why is dental health for early on, even when you're a baby, so important?
Well, it's just really important to take care of teeth as soon as they erupt, even before they erupt, for moms or dads to get into the mouth, get the child used to having someone in their mouth, even taking a wet washcloth or a little finger caught like this to just rub on the gums, clean the gums off after the child has had milk, gets them used to it, keeps their mouth clean and healthy. Once they have teeth that have erupted in the mouth, it's just very important to keep those teeth clean from milk and juice, which have sugars in them that can be really hard on teeth, that can attract bacteria that cause cavities. So just getting into the mouth and cleaning it, again, even with a wet washcloth when they're very small, is a helpful way to do it. But you can get these little finger brushes. You just put your finger in that and it'll brush. You can just get in there and brush their gums and brush their little teeth until they start getting more teeth. Then you can get them involved with taking care of their teeth and gums. You can give small children a small toothbrush, maybe with a little handle they can chew on, get in there and brush, but then you always need to go in and help them as well. Because until they're 8 years old, they don't have the dexterity to really clean their teeth and to get all of the bacteria off of their teeth until they're at least 8 years old. So they'll need help.
Perfect. When should you start bringing the dentist into the picture?
So the recommendation is that at 1 year of age, they start seeing their dentist. So we start seeing kids at our clinic at 1 year of age, gets them used to coming into the dentist. We put them in the chair, we give them a little ride, we show them the light, we show them the mirror. Just makes it a fun experience so that as they get older, they don't have any kind of dental phobias. So that's really helpful.
In terms of what are the risks for a kiddo, especially under the kindergarten, pre-kindergarten, for cavities?
So healthy snacks are really important. Sugary snacks, sugary drinks, even juice has a lot of sugar in it. Sounds like it would be a healthy thing to give your kids, but it's got a lot of sugar and that's really hard on teeth. Also with small children, when you're putting them to bed at night, avoid giving them a bottle with milk or juice in it, because then that sugar sits on their teeth all night and attracts the bacteria. They can get what we call baby bottle caries. So if you have to put your child to bed with a bottle because they are crying in the middle of the night or they won't go to sleep, make sure only giving them water. Also snacks, fruit snacks sound like a healthy snack to feed your kids. Hey, I've got some fruit snacks here, that sounds great. It's basically just sticky candy. So it's sugar that's going to stick to their teeth, allows for that sugar to attack those teeth. So you have to be really careful with what kind of snacks you're giving your kids also.
And even I imagine, let's say it's breast milk, right? There's still going to be some natural sugars in there.
Natural sugars in there, so that's the same thing. Nursing a child overnight can also create those sugars sitting on their teeth as well. So again, you just have to be very careful with doing that once they have teeth in the mouth.
So baby teeth, they're baby teeth, they're gonna fall out. So why do they matter?
Yeah, you know, a lot of people think, yeah, they're baby teeth, they're not gonna have them for long, so we don't have to take them to the dentist, we don't have to take care of these teeth. But what those baby teeth are doing is holding the space for your adult teeth. So if you don't have your baby teeth in there to hold a space, if you lose a baby tooth, then those other baby teeth are gonna shift and move, and then there's going to be nowhere for your adult teeth to come up. And when those adult teeth do try to come in, they're just going to be all not where they're supposed to be, because the space was not held by those baby teeth. So baby teeth are important. Plus, if those baby teeth get decayed, they can get infected, and they can cause a lot of pain for the little ones too. So we really try to avoid that.
So what are some of the other side effects of just poor dental health?
So your mouth is kind of the gateway to your body. The health of your mouth affects your overall body, your systemic health. The bacteria from the mouth has actually been linked to heart disease, stroke, diabetes. So if you have that unhealthy bacteria in your mouth and you're not taking care of it, it is being entered into your bloodstream and can go throughout the body and affect other parts of your body. Also, if children are in pain, they're missing out on school time or schoolwork because they're in pain, and they have to leave the classroom to go seek help elsewhere. So it's really important to have a healthy mouth from little all the way to big.
What if there's a mom out there that's like, thinks that she's doing a great thing by brushing her teeth and then handing her toothbrush over?
So I get it. I have a little one. I've done stuff like that. But no, not a healthy way to do it. When you're brushing your teeth, you're removing bacteria off of your teeth, and you just don't want to pass that along to your kids. Even like if you're sick, you can pass that along from your toothbrush to your kids as well. So better to have their own toothbrush and let them brush it and then help them brush their teeth, and you use your toothbrush just for you.
And I assume the same thing with maybe pacifiers. If you suck, is anybody who's sharing
Absolutely.
pacifiers or anything else that goes in your mouth?
It's just not a good idea. Overall, not a good idea. You pass a lot of things that don't need to be passed. Babies are actually not born with the bacteria that cause decay, and they don't get that bacteria until it's introduced from someone's mouth who has had cavities. So that can come from a toothbrush, or even, like you said, cleaning a pacifier or a sucker or anything introduces that bacteria into the mouth. And once the bacteria is there, it's there.
So they meant well, but maybe not a great idea.
Maybe not a good idea.
All right, so you're going to be out. Tell us a little bit about you guys getting out into the community in February.
Yes, so the Lincoln-Lancaster County Health Department is teaming up with Lincoln City Libraries and Community Health Endowment, and we're going out several dates in February to the libraries, and we're going to share some oral tips on taking care of your teeth with kiddos when they're doing story time. We'll talk to them about brushing and flossing, and then we're also going to be handing out free toothbrush kits. So for the kids and for parents, when they come in, they'll get a free toothbrush kit. It's got a brush, it's got floss, it's got toothpaste, it's even got a piece of sugar-free gum, and then some coloring pages and information on our clinic is in there as well.
Can you show us a couple of tips while we're here in terms of, just getting started with our kiddo to sort of get them used to the idea of brushing teeth?
Yes, absolutely. So starting when they're young, just, getting in there, laying them down, letting them take a look, getting in there with your finger, even just cleaning, getting them used to it. Once they start getting teeth, get in there and brush, because they will fight you on it. And, when they get a little bit older, they will, but you just got to do it. Also, what you want to make sure, this is just a big model, but what you want to make sure that you're brushing the inside, the tops, and the outside of all teeth. If the part of the tooth doesn't get touched with the brush, that you're leaving bacteria, you're leaving plaque on that tooth. So you've got to get in there and clean all the teeth. That's why they need help until they're 8, because they don't have quite the dexterity to get back there and clean their teeth all by themselves. So it's a really good idea for mom or dad or anybody to just get in there and help them brush their teeth.
And it's the same sort of thing with floss.
Absolutely, flossing is so important. People don't realize how important flossing is, but the toothbrush does not get in between the teeth. It's way too big. So you're leaving bacteria essentially between the teeth. What the floss does is it gets in and it basically brushes in between the teeth. You wipe that off, you're wiping that bacteria off the teeth. So you want to go in once a day and wipe that bacteria in between the teeth.
And when do you normally encourage flossing to start with?
As soon as they've got 2 teeth. If they've got something to floss, get in there. These little flossers are helpful. You just get in there. I started flossing my daughter's teeth as soon as she had 2.
Wow.
Yeah, so she's used to it. She knows that's what we do every night. Okay, we're gonna brush and then we're gonna floss. All right.
Any other tips or information you want to make sure the public has in terms of the importance, or if they need more information or resources?
Well, they could always come to the health department, our dental clinic. We have a clinic that we run, and we see kids, we see adults. You can find us at lincoln.ne.gov, keyword dental. Another thing that I would definitely stress with bottled water is not as good of an idea as tap water is, because tap water has fluoride in it, and fluoride also helps fight cavities, strengthens the enamel in the teeth to fight cavities as well. So that's another tip.
Thank you so much.
Absolutely.
And
Thanks
I
for having me.
encourage, if you've got a little kiddo and you've got the time, to come down to one of the libraries and in February.
In
correct?
February.
And check out the presentation and learn what you need to learn.
Definitely.
Thanks.
Great. Thank you.
Hi, my name is Dr. Libby Johnson from Lincoln Pediatric Dentistry. Today with me I have Nicole and my son Mac. We are going to go through some methods today on how to brush your infant and toddler's teeth at home. I will not be wearing a mask or gloves because this will be like how you are expected to brush at home. And this is also my child. And so the first way that we're going to talk about brushing with an infant, anywhere from infant to about age 2 or 3 even, is called a knee-to-knee method for brushing. If there are 2 people at home, have the child sit on one person's lap and lay backwards into your own lap. Mac will hold Nicole's hands, and then I will take the toothbrush here, and I am able to see directly into his mouth with the overhead light, and I get direct access to really brush all the teeth good, and that way I can see what I'm doing. And then that would be the first way to brush. Another method for brushing your child's teeth, especially if there's only one of you at home, is to sit on the floor. You'll have your child sit in front of you and lay back into your lap. This way the light is going into their mouth and you are able to see directly. It is okay if there's a few tears and they are crying, their mouth will be open for you to be able to brush and see. The next 2 methods I'm going to show you is how to brush your child's teeth from around age 2 till around age 8 when they are ready to brush their own teeth. The first way is to have your child stand in front of you. I'm going to have Georgia stand in front of Lisa here. She's going to look up to the sky, and Lisa's going to brush her teeth that way. It is very difficult to stand in front of your child and block the light this way, but standing behind them allows the light to go into their mouth and you to see what you're doing. If your child is older and too tall to stand in front of you, you can have them sit in the chair in front of you, same way, facing the same way and looking up, and you standing behind. The second method for brushing your toddler's teeth, anywhere from age 2 to 8, would be to have them sit in front of you. You would sit crisscross applesauce on the floor. They'll lay their head back into your lap, much similar to how we did it with the infant. That way the light is going directly into their mouth and you are able to see what you're doing. Flossing is also important if there are any teeth in your child's mouth that are touching. Lay your child back similar to the way that you did while brushing. If you see any teeth that are touching, use the same method that you did for brushing to floss your child's teeth. It's also important to remember to visit your pediatric dentist or dentist every 6 months. Just remember to visit your dentist as early as the eruption of the first tooth and no later than age 1. Your dentist will be a great resource for all oral health questions you may have.
Shape of the City is dedicated to keeping Lincoln informed of health and wellness programs and events. Visit our calendar at lincoln.ne.gov, keyword Wellness Calendar. If you'd like to see your program or event covered, email us at LNKTV Health at lincoln.ne.gov.